How will future safe sex practices prevent STIs? Imagine a world where protecting yourself during intimacy becomes easier, smarter, and more effective. Future safe sex practices aim to do just that by building on what we already know and adding new tools to prevent sexually transmitted infections. These infections can cause serious health issues, including reproductive cancers like cervical cancer linked to human papillomavirus. To reduce these risks, experts are working on better barrier methods, smarter prevention options, and more accessible screening tools. Condoms will continue to be the foundation of STI prevention because they create a physical barrier that stops germs from passing between partners. Future designs might include condoms tailored for different types of sexual activity, such as anal or oral sex, with stronger, more comfortable materials. Making these barriers more accessible and acceptable will encourage consistent use, which is key to their success. Alongside condoms, biomedical prevention tools like pre-exposure prophylaxis and post-exposure prophylaxis are gaining ground. These medications can prevent HIV infection when taken correctly, and expanding their availability will help lower HIV transmission rates, a major concern linked to reproductive health. Scientists are also exploring vaccines and new antibiotics to fight other STIs like gonorrhea and chlamydia, which can lead to serious reproductive health problems if untreated. Regular screening is another vital part of future prevention. Advances in rapid, easy-to-use testing kits will make it simpler for people to check their STI status frequently, especially in high-risk groups like teenagers, sex workers, or men who have sex with men. Early detection means quicker treatment and less chance of spreading infections or developing complications like cervical cancer caused by persistent HPV infections. Education and open communication between partners will play a bigger role too. When people understand their risks and discuss prevention strategies honestly, they can make smarter choices together. Future efforts will also focus on integrating STI prevention with cancer prevention. For example, vaccination programs against HPV will be more widespread, helping prevent infections that can turn into cancer later on. Screening for cancer precursors will become more common, catching issues early before they develop into serious health problems. Addressing social and structural barriers is essential for success. Stigma, lack of access to health care, and underfunded sexual health services can prevent people from getting the care they need. Future strategies will aim to make prevention tools more equitable and culturally sensitive, ensuring everyone has the opportunity to protect their health. By combining advanced barrier methods, biomedical options, targeted screening, education, and integrated cancer prevention, future safe sex practices will significantly reduce STI transmission and related health risks. This comprehensive approach will help people enjoy healthier, safer lives while reducing the burden of infections and cancers linked to sexual health. Always remember, for personalized advice and the best protection, consult healthcare professionals who can guide you based on your individual needs.